disorders are common in India, impacting over 42 million people. It's time to have the right knowledge to prevent and cure with proper screening and medical interventions.
Thyroid disorders are of two types mainly. We have hypothyroidism and hyperthyroidism. Hypothyroidism, the thyroid gland starts functioning produces less hormones, and this results in slow metabolism. Whereas hyperthyroidism, where the thyroid gland produces more hormones and resulting in a high metabolism. In hypothyroidism, there is weight gain, and with hyperthyroidism, with high metabolism, there is weight loss. So our diet can definitely help in controlling the weight. Simple principles: restriction on salt, sugar, ghee and oil. Focus on lean protein, which do not put on fat. And besides that, it has to be more focused on fruits and vegetables. So 5 servings of fruits every day. We must have a good breakfast, then a little lighter lunch and a very light dinner. Have early dinner and go for a post-dinner walk.
Women are more prone to thyroid disorders. Can you elaborate how hormonal factors lead to this gender disparity?
Correct. So if we see that thyroid disorders are more common in women as compared to men. Why is that so? There are so many factors which affect, and one of them is the hormonal factors. So we have estrogen and progesterone, which are the female hormones, and they get impacted during pregnancy and as well as even menopause. So if a person is normal but has become pregnant, then also because of the changes in the female hormones, the requirement of the thyroid hormone increases, and a lot of people will have in their reports decrease in the T3, T4 and increase in the TSH, which means that they are having hypothyroidism. When the TSH is increased, that means the thyroid gland is not functioning adequate levels of hormones, and we need to supplement that hormones. So that is hypothyroidism. And for example, I also during pregnancy developed hypothyroidism, and I had to take supplemental thyroxine supplements had to be taken. But after pregnancy, once that additional requirement is gone, I'm back to normal and I don't take any hormonal supplements for it. Similarly, post menopause, there are changes and there can be an increased requirement of the thyroid. So regularly, even during stress, things can happen. Then there are certain autoimmune conditions. For example, Hashimoto's thyroiditis. That is more common in women. We also have again autoimmune thyroiditis. These are the diseases which are more common in women, autoimmune conditions which can impact the thyroid gland. Besides this, we have, for example, some people may have, girls especially, I've had 2 relatives who had developed papillary carcinoma of thyroid. So that means that's a cancer of thyroid, and which can occur in young females. So a regular thyroid screening is very, very important. Then we can, besides this, I think stress plays a huge role, and there can be so many changes which happen, with some infections also. For example, TB of the thyroid gland, that can also happen. So young females, sometimes weight gain or weight loss is just an indicator of a thyroid disease, and that is why I think definitely screening is important. Yeah.
Can you explain the importance of taking regular screening for thyroid health?
Screening is very much essential because a lot of people who have got thyroid problems, especially hypothyroidism, may not have frank symptoms. It may just manifest as weakness, tiredness, maybe hair fall, dryness of the skin, weight gain, some menstrual problem, like it can be more excessive bleeding. So these are early signs of the hypothyroidism. On the contrary, if there is hyperthyroidism, then there can be more of anxiety, weight loss, excessive sweating, menses can be less, the palpitations can happen. These are symptoms of thyrotoxicosis or hyperthyroidism. A regular screening will help in preventing these complications. This is the importance of a regular screening.